If you're looking for a slice of skepticism in your life, then I think you've clicked on the right video for today. I have a couple of video clips I'll show you in today's video. One is from BBC News, a recognised news source, and the other is from Computing Forever, an Irish man named Dave Cullen, who chooses to make his videos, YouTube videos, full-time. But before I show you those, I need to recap for you my last video and respond directly to a comment. If you didn't see my last video about the global coronavirus pandemic, I spent a lot of time showing you the Johns Hopkins map and covered several topics in the video. The topics I covered included skepticism of journalists, incorrect or incomplete map locations, the quantity of locations being incorrect, a factual method behind how numbers can be incorrectly recorded and misrepresented, a conspiracy theory about cell phone subscriptions being cancelled, skepticism of China's reported numbers, a past example of the Soviet government misreporting deaths due to the Chernobyl disaster, and the current reported numbers of coronavirus in New Zealand. All of these various topics relate to the numbers in some way. Numbers the journalists report, numbers of map locations, numbers can be misrepresented, numbers of cell phones cancelled possibly due to coronavirus, China's numbers, the Soviet government's Chernobyl numbers, and the current New Zealand coronavirus numbers. And most of these topics relate directly to the coronavirus, which is why the video was titled Week 2 Modelo Bug World and New Zealand Numbers. Some of my videos substitute the term COVID-19 with the fictional term Modelo Bug to avoid demonetization, which is why coronavirus is not mentioned in the title of that video. In response to this video, Hamish left this comment. This video seems to be about misreporting, in particular by journalists, but then you provide incorrect map pins, which isn't evidence of numbers being manipulated, and a conspiracy theory about cell phones, many of which could be work phones, as your evidence as to why the numbers are higher than being reported. This really makes your video a conspiracy theory video, and I don't think that is where you were wanting to go with it. I'm not doubting your conclusions, I'm doubting the evidence you provided to get there. Well, for one thing, I'm glad that Hamish is skeptical. We all need a dose of that. Other than that, I'm not really sure how to respond to this comment. Suffice to say, the original video's theme was actually about numbers. All 7 talking points covered numbers and skepticism as to how and why they are reported. I want to make an important distinction here. Skepticism is not the same as a conspiracy theory. I would say that a reasonable definition of a skeptic is a person who is inclined to question or doubt accepted opinions. And I would say a reasonable definition of a conspiracy theory would be a belief that a covert but influential organization is responsible for an unexplained event. Yes, I've taken screen grabs here, but I think that those are reasonable definitions. But it's important to keep in mind they're not the same thing. To respond directly to the comment, it's not a conspiracy theory video. Because the one thing in the video that is specifically mentioned as such, which relates to the cell phones, isn't presented as truth, since I say that there could be explanations for this. Now, there are potential explanations as to why this could be. So, some of the explanations for this could be along the lines of people had 2 cell phones and they cancelled one subscription because they're not using the second cell phone, things like that. Instead, it's something to make you question the narrative that you are being given, which would be encouraging you to be skeptical. But it does sort of ask the question, doesn't it? It makes you wonder. Moving on. A light-hearted bit of fake news circulated on Twitter recently whereby a claim was made that lions were released onto the streets in Russia to keep people indoors during the pandemic. There is no doubt in my mind that this was done as a joke, but the problem is there are people out there that are actually so stupid that they'll believe it. Posts like this can go viral because people who like the joke, they want to share the joke, and the people that think it's real want to share it because of how outraged or upset they feel about it. We should really think more carefully about posting things like this. No, it's not because we don't get the joke, it's because that there are other idiots out there that legitimately think that it's true and they'll share it. And in that instance, does the video actually start to cause harm? It would cause harm by scaring stupid, gullible people that would otherwise not be worried because they didn't know, because you didn't share it. And let me just qualify this again by saying that those of you who know me and personally, you know what I do for a job, then I hope my word means something when I say that there are a lot of stupid people in the world. Now, you may be a smart one yourself, doesn't mean that everybody is actually that way. There are stupid people out there. Now, recently BBC News published a great little video on their channel, which illustrates the importance of a skeptical mind in the instance of viral posts such as this. This video is about 3 minutes long, and the link to the original video and the next video are in the video description.
In the midst of the coronavirus pandemic, passing on information can feel like one way we can support our families and friends.
Here at the BBC, we are working very hard to make sure that everything we broadcast and publish is accurate and up to date. But there is a whole load of information out there that isn't.
Notice how she says that they work hard to make sure the information is accurate and up to date. I think it's important just to pause here a moment and actually listen to what she's saying. What she's saying is that we actually try. We're actually trying. And I'm not saying that BBC is bad, far from it. I think BBC actually does a fairly good job. But as I said in my previous video, journalists piece together stories with incomplete information to tell the story as best they can. So keep in mind, the message from this journalist is the same as my advice, which is be skeptical. And she gives certain criteria too as it relates to who reported it, is that person reliable, or has it been reported anywhere else?
And misinformation can spread fast. If a message is sent to a WhatsApp group of 20, then each of them shares it with 20 other people, and this happens 5 times, it can reach more than 3 million people very quickly.
If you're not sure the whole post is true, it might do more harm than good to share it. And if the source isn't easily identifiable or the story hasn't been reported elsewhere, then it really is worth being skeptical about it.
Pictures taken out of context can also be really misleading. A video from Italy was posted on Twitter showing military vehicles on the streets. There were rumours they were responding to coronavirus riots. In fact, they were returning from routine exercises that had nothing to do with the outbreak. Some of us may share information with our friends as a joke or to lighten their mood. But even if they don't take it seriously, others might. For example, a claim that lions were released in Russia to patrol the streets was taken seriously by some. It was not true. We all want to share news that we think will help others, but before you do, follow these steps. Has the story been reported anywhere else? Is it from a reliable source? Has the photo or image been taken out of context? If you're not sure, then maybe it's fake. And you can stop that information from doing harm by not sharing it any further.
Now, I think it's important to qualify actual skepticism here and why it's so important. Skepticism is important because human beings have many motives for being dishonest. And that dishonesty often serves to gain your trust or to save face or for financial gain. Some examples of people lying would be a used car salesman. He has a motive to sell you a car that he wants gone from the lot. Maybe there's a problem with the car. A politician has a motive to make you vote for him or her based on a promise that they either can't or won't keep. Either they have no intention of keeping it or they know that it's not likely that they'll be able to keep it. But they want your vote regardless. The government has a motive to look good in the eyes of the international community. I could give many examples of that, but we'll just leave it as that. And an organisation has the motive to be dishonest to receive more government funding. Now, these are very broad and non-specific examples, and they're just part of human nature. People can be dishonest. Now, a famous fictional doctor named House once said, "Everybody lies."
You're dying. In a few hours. There's nothing we can do except deal with the pain.
Well, I need to go home.
You're not going home.
But my dog. What will happen to my dog?
Any of you guys go the dog route in your improv sessions? It's a basic truth of the human condition that everybody lies. The only variable is about what.
Okay, I want to close out this video with one more dose of skepticism. This next clip, which is about 4 minutes long, is from Computing Forever, and it's a perfect example of why constantly questioning the accuracy of journalists and of each other is important. In my previous video, I asked the question, is China underreporting the numbers of deaths from coronavirus? And in this particular video clip, we asked the question, is Italy over-reporting the deaths? So have a look, and as I said before, all the links to these videos are in the description.
So why are the numbers so high in Italy? At the time of making this video, there have been 786,291 confirmed cases of COVID-19 globally, and 37,820 deaths. In Italy, there's been 101,739 confirmed cases and 11,591 deaths, which is the highest of all, followed by Spain at 87,956 confirmed cases and 7,716 deaths. Italy's 11,591 deaths represent a fatality rate of just over 11%. That's very high. The United States, however, with its 164,620 cases and 3,170 deaths, represents a fatality rate of 1.9%. In Germany, they've had 66,885 confirmed cases and just 645 deaths, which represents a fatality rate of about 1%. So why are there such disparities in fatality rates between different regions? And are there local factors to consider in each nation? On the 23rd of March, The Telegraph reported the following. Why have so many coronavirus patients died in Italy? The country's high death toll is due to an aging population, overstretched health system, and the way fatalities are reported. According to Professor Walter Riccardi, scientific advisor to Italy's Minister of Health, the country's mortality rate is far higher due to demographics. The nation has the second oldest population worldwide, and the manner in which hospitals record deaths. So this isn't some random doctor here. Professor Walter Riccardi is the scientific advisor to Italy's Minister of Health. He goes on to say, the age of our patients in hospitals is substantially older. The median is 67, while in China it was 46, Professor Riccardi says. So essentially the age distribution of our patients is squeezed to an older age, and this is substantial in increasing the lethality. A study in JAMA this week found that almost 40% of infections in 87% of deaths in the country have been in patients over 70 years old. And according to modelling by Imperial College London, the majority of this age group are likely to need critical hospital care, including 80% of 80-somethings, putting immense pressure on the health system. But Professor Riccardi added that Italy's death rate may also appear high because of how doctors record fatalities. He says, and this is the most important thing, the way in which we code deaths in our country is very generous in the sense that all the people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. That is absolutely absurd. That's not in any way a scientific means of operating. He goes on to say, on re-evaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one pre-morbidity. Many had 2 or 3, he says. So, just 12%. Well then, that figure of 11,591 deaths would actually be 1,390 deaths. If that's true, then why hasn't this updated figure been factored into the Johns Hopkins University map that we're all using? And as I've previously reported, Professor Dr. Sucharit Bhakdi, he's a medical microbiologist and infectious disease epidemiologist, and he said, "In my conviction, the terrible error made in the entire world is that whenever the virus is detected in a deceased, it is automatically assigned as the cause of death and enters the awful list of the corona dead. This violates a basic principle in medicine. It simply must be established that a patient dies because of, and not simply with, a virus. This is explicitly stated in the German medical guidelines, which are, however, not heeded in the case of COVID-19. Hence my question to the Chancellor, has Germany simply followed the global trend of unscientifically categorizing and defining COVID-19 related deaths? And does Germany intend to continue breaking the established rules? How then can you ever hope to differentiate between virus as the cause of death and virus accidentally present at death?" This is important because what Professor Bhakdi has said lines up perfectly with what Professor Walter Riccardi has said, that if a patient dies and they happen to have COVID-19 coronavirus, then their cause of death is put down as them dying from the COVID-19 coronavirus, even if COVID-19 was not the cause of their death.